Good afternoon. Thank you for joining us today. I know we're being eclipsed by other news today, so I appreciate your time. I couldn't help that. We're gathered here today on the traditional territories of the signatories of Treaty 6, and I acknowledge the Métis people who share a deep connection with this land. My name is Dr. Luanne Metz, and I'm the Alberta NDP Critic for Health. I'm joined by my colleague, Janet Aramenko, our critic for mental health and addictions. Danielle Smith and the UCP are still lying to Albertans. We all recall that just over a year ago, Danielle Smith fired the entire board of AHS and promised to fix healthcare in 6 months. And she made a big promise, one that should have been kept. When she fired the board and appointed one administrator, he promised that no one would wait beyond a reasonable wait time for their surgery by this March. And Danielle Smith said she was confident this would be possible, especially because she planned to privatize more surgeries. Well, the Premier failed, and not just by a little bit. Last week, the Canadian Institute of Health Information released a report using the Government of Alberta's own data showing that we are not even close to the surgical wait times that we had in 2019. Only 59% of Albertans are getting their hip replacements within 26 weeks, which is the definition of an acceptable wait time for this critical surgery. Worse, less than half of patients waiting for knee replacements are getting them on time, and only 61% are getting cataract surgeries on time. But let's be clear, being on time means waiting up to 6 months for these knee and hip replacements, and that's only the wait after a surgeon puts them on the wait list. Most patients are waiting for months or years in pain, often with disability, before even getting an appointment with a specialist. We don't even know how long patients are really waiting because these times are not even tracked. But the UCP is not meeting its own targets and certainly has not cleared these wait lists. As a result, Albertans are needlessly suffering, often in agony. Doctors, nurses, and other health professionals and everyday Albertans all know that we are in a healthcare crisis. This report is further proof that they are right. So that's why we're speaking here today. Danielle Smith and her health minister keep saying there is nothing wrong, that the problems that we are all fixed and we should all be satisfied. In fact, they claim things are getting better, even when their own data shows otherwise. Last week, the Premier and Minister for Mental Health and Addictions made multiple claims that their recovery-only strategy has been a great success. Yet, in 2023, Alberta recorded its highest ever number of deaths due to drug poisoning. And they say things are trending in the right direction. 1,706 Albertans died between January and November 2023. That's an average of 5 people every day who have lost their lives. This is the second highest rate in the country, and it's been getting worse, not better, since 2019. This is by no measure a measure of success. We know healthcare can be better in Alberta. We expect it to be better, and there is no reason that it's not improving, except for one thing. Danielle Smith and the UCP refuse to take our healthcare crisis seriously. Instead, they report improvement by comparing their data to the worst year in recent time. That was last year. If they truly were transparent with Albertans, they would acknowledge that sinking many millions of dollars into private surgery clinics has not worked. Instead, despite the workforce shortage, they've made it more attractive for anesthesiologists to work in chartered surgical facilities where only the most straightforward cases are managed, instead of working in the public system. This leaves operating rooms empty in our public hospitals, even though with more staff on hand, we could be doing more of the surgeries that Albertans need. And we are risking having sufficient anesthesiologists available for urgent surgery. Instead of better public health care, the UCP has discharged patients to motels in cities down the highway where their healthcare needs cannot be accommodated. Instead of better public health care, the UCP canceled a hospital in South Edmonton that's been needed for decades. And worse, the Premier suggested on her radio show that patients can just head south to Red Deer for the care they need. That is why I intend to bring forward today an emergency motion this afternoon on Alberta's healthcare crisis. It's time this legislature debates the misleading spin from this government and acknowledges that their own data shows that Albertans aren't getting the surgeries they so desperately need. People are in agony. Albertans are dying. And the UCP needs to fix this. Starting by abandoning their ideologically driven campaign to privatize healthcare, and rather invest in public hospitals and commit to publicly provided surgeries. That is why we think the UCP should welcome an emergency debate on this critical subject. I'm happy to take your questions.
Thank you, Dr. Metz. We'll start with questions in the room and then we'll go to Zoom. And just a reminder for everyone who is on Zoom that it's the raise hand function. And for those on the phone, it's *9 to get into the question queue. So we'll accept one question and a follow-up. Please state your name and outlet and who you'd like and your question. Is there a question in the room? No questions in the room. Any from online? Seeing none, that'll be the end of the press conference. Thank you very much.
Thank you.